Goiter is the swelling of the neck caused by enlarged thyroid gland. It is one of the most common thyroid disorders, especially in women. That's our focus today on sound health. I'm Olasumbo. Welcome to the show. Thanks for staying with us on Sound Health. Today, Dr. Folusho Omodele, a general consultant surgeon, will enlighten us on causes and treatment of goiter. Welcome to the show, Doctor.
Good afternoon.
Okay, goiter is one of the most common thyroid gland disorder, and we would like to know what causes this disorder in people.
Well, goiter, generally it's swelling of the thyroid gland, and the thyroid gland is located, the anterior aspect of the neck. So, and it's called bebe in Yoruba. The major cause is actually relative lack of iodine in the body. Okay. Right? Other things that may cause it will include, some congenital problems, and problems since birth, maybe the absence of certain hormones in the body.
Okay.
Then, those are the main causes.
Okay, doctor, apart from swellingness of the neck, what are the other symptoms to watch out for?
So, goiter just refers to the fact that that gland is swollen. Okay. Right, but once it's swollen, it depends on the activity. Some of them may swell and it will be the cancerous type. Some may swell in which the hormones produced by the thyroid gland, they are produced in excessive quantities. Some may swell in which they become inflammatory. There's some very rare causes, we call them inflammatory causes. And some may swell, they won't produce hormones in excessive quantities, but they may put pressure, right, on the adjoining organs, right? Maybe the windpipe, the foot pipe, or even the nerves surrounding it. So it depends on the behavior of the goiter. But goiter is just a general term to tell you that this gland is swollen.
Okay, doctor, in your earlier response, you mentioned iodine deficiency as a major cause of goiter. What are the other types? Are there types of goiter?
Like I've told you, it's relative, lack of iodine. Because if iodine is lacking, right, the body will know, and it will respond in such a way that it will now want to pump the organ to produce more. So it ends up getting larger than normal. Mm-hmm. So that's the major cause. But what are those things that can now lead to relative lack of iodine? One, if you don't have enough iodine in your diet, right? Two, if, like in this part of the world, consumption of large quantities of cassava-based meals, right? You can find that in some parts of Badagry, Lagos State government spent a lot of money, right, taking care of patients from Badagry, quite a good number from there, right? People who live in Ijebu waterside too, they consume a lot of gari, so that's another thing. Then you find that it's much more common in women, because women tend to have relative need, that is much more than that of a man, because they get pregnant. And apart from getting pregnant, they lactate. Those are things that tend to put a little more pressure on the thyroid gland.
Okay, doctor, how true is the fact that it is harmless, and with that you don't need to treat the condition? Do I need to worry about sleepless nights when goiter sets in?
Right, in some areas of Yoruba they say that it's really not, but it can be harmful. Like I've told you, it depends on the activity of the gland, right? Okay. If it becomes cancerous, of course, that's harmful, right? So you have to do something very fast about that. if it produces hormones in excessive quantities, right, that's what we call thyrotoxicosis, and it gives rise to very, very terrible symptoms. And those symptoms will include things like too much sweating, right? People have what we call palpitation. They are aware of their heartbeat. They eat a lot, and they lose weight. You know, that's why the fact that they eat a lot. Apart from that, they go to toilet very, very frequently, right? And the weight loss will make them look very scary. They look like witches, right? And it can even cause anxiety, right? And even, you know, things that look like maybe mental disorder. So if you allow that kind of thing to go on for a very long time without treatment, it can even lead to death, because it may affect the heart, and the heart will fail. Heart failure and all those other problems can kill the patient. So it's not just completely harmless. But the harmless ones are the ones that tend to be quiet in terms of production of hormones, and they remain non-cancerous. So the only problem with that is just the sight, ugly sight, tend to give.
Okay, and that tends to worry so many.
Yes, of course, an average woman will not just take that at all.
Okay.
Right? So that's cosmetic, you know, blemish. So it's one of the major reasons why we operate anyway.
Okay. So doctor, how do you diagnose this condition apart from the physical feature that, okay, I think this person has goiter due to the swollenness of the neck? How do you diagnose? Are there tests to?
Yes, of course, it's very visible to an average person. Most people tend to have it, maybe their spouse or a friend tend to notice that when they swallow, something moves up, you know, the neck. So it's always very easy to diagnose. But the only thing is that when we diagnose it, we want to know what kind of activity, right?
Okay.
So, and like I've told you, the test we need to conduct will be blood test to know whether the hormones are produced in excessive quantities. One, we want to take certain bits of it, send to the lab to know whether it's a cancerous type, right? And we want to test the blood too, to see whether certain parameters are okay or not, whether the kidneys are functioning very well, whether, you know, the other ions in the body, they are okay. So the tests are actually to look at the physical condition of that patient, whether they are fit or not, whether we need to use drugs to get certain things. And like I told you, they may cause some degree of heart failure. So those tests too will give us an idea whether there's heart failure that we need to treat.
According to a report, women between the ages of 40 and 50 and pregnant women, they are more liable to have goiter. Could this condition also be genetic?
Some are genetic, right? But those genetic ones are not the one we're talking about today. We're talking about the ones that tend to affect people who don't take enough iodine. And like I've told you, look at that age range. It's the age range where people tend to give birth, right? They're still in the childbearing age group. And like I've told you, pregnancy, lactation, they tend to put a lot more pressure on the thyroid gland. So if you're in that age range, it is always better to take food that is rich in iodine, especially those ladies that tend to, give birth to kids, with very little time interval between one kid and the other. So it's advisable that you space your kids.
A research by the Lagos State government during an intensive campaign in Badagry, members of the public in that axis believed or had this misconception that if you used cup to drink water, you end up with goiter. How true is this? Has this been confirmed medically?
Okay, well, I think, people have myths, misconceptions and everything, but I was actually part of that party anyway. Okay. One thing we find out, and we're still conducting a research on that, the result will come out very soon. Okay. But the preliminary report is that it is actually related to the consumption of, cassava. There is a form of cassava take a lot in Badagry. Okay. So we attribute that to it. Okay.
Okay, not because of
No,
the
not
use
because
of
of the use of cup.
Okay.
That's nothing to do with it.
Okay. As we wrap up this segment, Dr. Omodele, how do you prevent goiter? And if you're living with goiter, how do you manage this condition?
Well, the first advice is to take iodized salt, right? And thank God the federal government came up with a policy, I think in 1995, in which any salt, that is produced for local consumption in Nigeria must be iodized, right? Then they won't allow people to get what they call the so-called industrial salt into the market. So that's one. The amount of salt we take in our diet generally will give us the required amount of iodine we have in the system. So that's one. Then people should make conscious effort to eat right. And what do I mean by that? Make sure that while pregnant, you take food that is rich in iodine. And when you go for all these antenatal clinics and everything, they give you an idea of all those food. Seafood, take plenty of fruit, vegetable, milk, and all those things. Then you have enough iodine in that system that way. So that's the major advice. Don't take industrial salt. Take salt that is rich in iodine, right? So that's one. Then in terms of treatment, the problem we have in this country is that people wait for things to start before they treat it instead of preventing it. Prevention is better than cure, right? And what do I mean by that? Most people, when they now have goiter that is very visible, that's why they start looking for iodine containing, but that's not the way to do it. Because once it's there, it's very difficult to suppress. So most of the time, once you make the diagnosis, most of the patient will end up on the operating table.
Thank you so much, Doctor, for sharing your expertise with us on preventing and managing goiter.
Thank you very much.
All right. Okay, that has been Dr. Folusho Omodele, a general consultant surgeon on managing goiter. Sound health continues with trending and home essentials. Please stay with us. The program continues in a moment.
This week on Sexual and Reproductive Health Rights. Sexual and reproductive health, including family planning, is critical to the fulfillment of human rights. Family planning is widely recognized as one of the most cost-effective health interventions. Decades of research have demonstrated that modest investments in family planning can save lives and dramatically improve maternal and child health. There is a growing push in the development community to reprioritize family planning because of the cross-cutting role it plays in achieving broader development goals, including the Millennium Development Goals and poverty reduction. Most fundamentally, access to sexual and reproductive health services enables individuals and couples to plan their sexual and reproductive lives, forming an essential aspect of human dignity and freedom. As pronounced at landmark United Nations conferences on women, population and development in Cairo in 1994 and Beijing in 1995, the right to control the number, spacing, and timing of one's children is fundamental to exercising reproductive rights. To do so means that individuals and couples must have the information and means to make informed decisions regarding their sexuality and reproduction. Moreover, the human right to family planning enables the exercise of other human rights, such as gender equality, for example, by allowing women to expand their life opportunities, increase their negotiating power, and raise their socio-economic status.
Well, this is where we say thank you on today's edition of Sound Health. Remember, taking food rich in iodine, lots of seafood and fruits will help you keep goiter at bay. That's our focus today on this edition. Please send SMS to 0818-815-3695 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.